You know chiropractors, when they adjust people, you hear a sound, right? Let me just really quick tell you that the sound has nothing to do with the adjustment. It's only gas escaping and going into the bloodstream again. That's all it is. There could be no sound, you still get the adjustment. People associate crack and pop, and they get addicted to what I call crack. So don't get addicted to crack. Not a good idea to get addicted to crack. Crack kills. And so does it. If we were to crack a spine, it would kill the person. So we're not in business to kill people. We're in business to move bones, allow flow to go. Now, sometimes, and this is where it's going, we won't even have to touch the patient sometimes, or very lightly.